The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today's guest is our first guest from Europe. He was a little bit late joining today. I think he was making waffles and chocolate. David de Vilde is joining us from Belgium. David, thank you so much for being here.
Thanks for having me.
So you are a testicular cancer survivor, but before we get into that, I want to talk about what is it like in Belgium? I've never been. I know you got chocolate. I know you got waffles. What else is going on?
What else is going on? Whoa, that's a big question. I'm an archaeologist and an art historian. So at first we have lots of old cities and old buildings and stuff like that, which is awesome for me. What else do we have? Oh, I think one of the main differences is we have social security. Wow. That'll come into the story. Otherwise, Belgium is just a tiny speck of a country. I have a friend on Vancouver Island, Canada, and we found out that Vancouver Island is bigger than Belgium. Wow. Just to give you an idea. That doesn't mean that we don't like to complicate things. We've got 7 parliaments, probably more ministers and secretaries than the US and Canada combined. We're a pretty small country with a whole lot of people for a small country as we are. In the middle of Europe, Brussels is our capital. What else is there to say?
Well, let's
Belgium
talk about
fries, waffle, chocolate.
Let's talk about, as it relates to testicular cancer, like what is healthcare like in Belgium?
Well, in general, everybody has a primary care physician, but there's no such thing as having an annual checkup or something. You get to your doctor whenever you like. Most people will pay, I think, €6 for a regular doctor's visit. I'd pay €1 because I have extra social security, let's call it that. So it's pretty easy. You can make a doctor's appointment with any specialist you want. Usually they ask for a referral. We've got local hospitals in every major city, and then like the big centers, the major hospitals are usually the hospitals that are connected to the universities. So those are the places you want to go for more complicated matters. But let's say testicular cancer is something they can do in a regional hospital as well.
So let's talk about your testicular cancer. What was it that initially kind of piqued your attention down there that something was wrong?
Well, for starters, nobody talks about testicular health in Belgium. There's no such thing as an organization that says something about, hey, take a look at what's down there. Basically, the only attention to cancer in general is female breast cancer and prostate cancer. Otherwise, there's basically no talk whatsoever about cancer. But quite a few years ago, I read an article about a young guy that was thought that you should do regular testicular exams. He was on an exchange program in South Africa, and the boys that are 17, 18 years old over there apparently get a class where they are taught about how to do a testicular self-exam. And that boy, well, he did his first testicular self-exam when he was in South Africa, and he found out there was something wrong. Turned out he had, in fact, testicular cancer. So just reading that story told me that maybe I should do testicular self-exams. Well, and there's not much to it. So I got in the habit of just regularly checking my testicles. All fine and well. Until somewhere early 2020, I noticed that Mr. Ridey seems to be getting smaller, but obviously that's something that goes around in your mind, and you're pretty sure that it's nothing really, it's especially nothing you want to discuss with your doctor. But at the end of the summer or beginning of September, I noticed that there's something hard in my right testicle, and that got my attention. And I still wasn't pretty sure if I needed to see a doctor about it, because although I heard about testicular cancer, I wasn't really concerned about it. But I discussed it with my brother-in-law, and he was like, maybe it's best to go and see your doctor. Now, the funny thing is, I had just switched primary care physician, and my new doctor, the only thing he had done for me that far was a COVID test. And so September 10th, 2020, I went to his office for the first time, telling him, well, there's something happening, and would you be so kind to check my testicles, please?
And this was the first time you'd ever seen this doctor?
I had seen him before, but just for a COVID test.
Oh, okay. That's right. You said that.
Not even for a cough or a cold or anything. So I was pretty nervous, there's also no such thing as a regular visit to your doctor where he just does a full screening. So there's no standard testicular exams that a doctor does. So basically it was the first time that I had a doctor checking me down there since I was a kid, where the pediatrician checks to see if your testicles have descended. That's something that happens. But after that, nothing. So there I was at my doctor's asking him to, well, would you please check my testicles? There's something odd. He was very professional about it, there's just as any doctor would be probably. And he did his examination, and then he concluded, basically asked me, well, let's go sit down. And he said, yes, I noticed that the right testicle is indeed atrophying. And I do feel something hard inside. And because it's painless, this has me concerned. And he asked me if I had an idea of what this could be. And of course, I had already passed by Dr. Google. So I told him, well, the only thing I can think of is testicular. I think I told him the only thing I can think of is something I do not want to think of. That's what I said. And he basically said, well, that's what I am thinking as well. So usually your doctor, your primary care physician, will write a letter and send you through to make an appointment with a specialist, in this case, a urologist. But sometimes, it doesn't happen often, a primary care physician will pick up his phone, and call the hospital himself. And if that happens, it's not a good sign.
Yeah.
That means that he wants you to be seen early and as quickly as possible. And that's what he did. He picked up his phone, he called the hospital, and he arranged for me to be seen the very next day. So Friday evening, 9/11, I was at the urologist's office. And for the second time, showing my privates to a doctor I had never seen before. And he took an ultrasound because most urologists in Belgium have their own ultrasound equipment. So they can do a testicular ultrasound by themselves at that moment, which is quite a relief because at least you know where you are at. So he did the ultrasound, and even I could immediately see on the ultrasound that there was something not right. And then he put the Doppler on, where you can see the blood going through, and well, the testicle just lit up like a disco ball, you know. So I knew something was wrong, and I knew if something is that vascular, it's probably cancer.
Yeah.
And he just said, oh, well, that looks bad. That has to come out as quickly as possible. So I asked him, do you mean this is cancer? And he said, well, yes, of course. And at that time it was 7:30 p.m. And there I was outside at the hospital, like outside of the office in the hospital. He told me, our lab where they do blood draws is still open. Go and have your tumor markers checked. And that's it. So I took a cab to get back home, and usually I'm always talkative and I talk with a cab driver, but that time I was pretty silent.
Yeah.
And then 11 days later, by then I had all my scans. I was admitted to the hospital for an orchiectomy, and that's where things started. And then this is the weird part, you know, it's, I was lucky. I was stage 1 pure seminoma. So, I just had a surgery and there was no follow-up treatment. I wasn't offered any choice, like many people are, to do carbo or not. I was just sent straight off to surveillance. I even never met an oncologist. My surveillance is done by the urology department. And Oh, there is an oncologist looking at my file, but since they have no work to do with me, I never even got an appointment. So yeah, it's a bit weird. But as usual, I have 6 monthly scans and 6 monthly checkups.
Yeah. So jumping back to like when you noticed your right testicle was atrophying I can't remember how you said it, but
I don't know. I don't even know how to say it.
but so I think
slowly dying, basically.
yeah, getting smaller, right? So I think you're the first person I've talked to on this podcast and even off the podcast about testicular cancer who rather than getting bigger, it was getting smaller. So how much smaller did it actually get?
By the time it got out, it must have gotten less than half the size it used to be. So what probably happened is that the cancer cells took away the blood flow from the rest of the testicle. At least that's what I've been told. So by restricting the blood flow to the rest, it slowly started dying off, while the tumor started growing and growing.
So you said you had like 11 days before you had your orchiectomy. You had all your scans in that time. What scans did they do? They did the tumor markers. Did they do another ultrasound or like a CAT scan, or what kind of stuff were they doing over there?
They did a CT scan of my lungs and a CT scan of my abdomen. Abdomen till pelvic region, basically. Yeah.
So when the doctor, like you had known testicular cancer was a possibility, and then when he so casually just said, yeah, it's testicular cancer. Like, what was that like for you mentally?
At first I was just numb. I didn't really have time to be sad or crying or whatever. I was just numb. This was full COVID period, so I was completely alone. They agreed to see me the next day that I was at my PCP's office. But I was the last patient. The secretary had left the office. The hospital was closing. And I was there alone. My wife was not with me. I had no one to support me. It was a pretty nasty nightmare experience, really. So I called my wife and put her on speakerphone at the doctor's office, which is something I still do when I have an important doctor's meeting and I'm alone. I'll put someone on speakerphone for them to be able to follow up and ask the questions that you're forgetting about because you're just numb. But he was, I changed urologists afterwards, because he was just too casual about it. He didn't even say, "Sir, I'm sorry, but you have cancer." I had to ask that question myself. I had to ask him, "Do you mean this is cancer?" And he's like, "Yeah." But, you're lucky. If you have to have cancer, well, testicular cancer is probably the best one to have. And while this is probably true, it's still not the nicest thing to say to a person who just got a cancer diagnosis.
Yeah.
So the following week, I have bipolar disorder. So when something big like that happens, I will either get very depressed quite quickly, or I will go manic. And people usually think that manic equals euphoric, but it doesn't. Manic means an excited state of being psychologically, but that can also be extremely overwhelmed or extremely, basically extremely active, but it can be in a negative way as well. So that's what we call dysphoric manic, as contrast with being euphoric. You can be dysphoric, which means bad feeling, basically. So the first day I was numb, I had to explain to my children. I had 2 children back then. I still have 2 children, but they were, how old were they? Let's see. They were 10 years and 13 years old. So I had to tell them. Afterwards, I called my parents. My mom is a breast cancer survivor. And so it was extremely difficult to tell her that I had cancer. And then I went to a very manic state because I was so overly busy in my head, thinking of all the possibilities of everything that could go wrong. So that's what was keeping me on. It was keeping me away at night. But luckily I was able to get to my psychiatrist very quickly. Like I have a number that I can call for emergencies, and this kind of qualified as an emergency.
Yeah.
So she was there to follow me up on it, but it's still weird thinking about it. It's as if you're not living those days. I'm sure you can imagine what I mean.
Yeah. I mean, is that something that like the urologist who wasn't exactly your favorite, who was so casual about it, is that something that was in your chart that maybe he should have seen and kind of known to kind of be a little bit more graceful with it?
It was in the letter that he got from my PCP, but he just skipped the entire part where it sums up my health status, and he just skipped to the last part. It said, "This is the question of my doctor," and the question obviously was, testicular problem, what's the cause? That was a question my PCP asked, which is normal. So he just skipped all the rest. While you wouldn't notice it during a conversation like this, but I'm on the autism spectrum as well, which is something that was very clear in the letter. But he just ignored it. That's one of the reasons that I decided not to remain in his care. But doctors, in my experience, specialists either go 2 ways when they find out you have autism and you're bipolar. Some doctors will take it slow and take extreme measures, even beyond what's necessary. And other doctors will often treat you as if you're mentally unstable and you're mentally, they will just be wondering whether you're insane or not, which obviously isn't the case. But doctors go either way. Luckily, my experience is that most doctors will be just a bit more careful, which is needed, really. It's what they are supposed to do. And I've grown pretty strict since my cancer experience, that if doctors are not considerate in this matters, then I will just skip and find someone else.
Yeah, you got to do what you got to do. You mentioned your wife and your two kids, and they're kind of at the time, they were definitely at the age where they would have known something was going on. So how did they all handle this?
My wife, of course, already knew because I had her on the phone at the urologist's office. We were quite clear that we immediately had to tell the kids. So when I got back home, we asked them to come and sit down around the dinner table, and we told them that I had cancer. That this means that I was pretty ill. But we also told them that, well, one of them immediately asked, does this mean that you will die? Which is a pretty straightforward and honest question, but it's also a pretty hard question to face. But we said, well, no. We told them no because we told them testicular cancer has a high cure rate, and I will get better, but we don't know how sick I am yet. This can go either way. Of course, because their grandma had breast cancer, my mom had breast cancer. They knew what cancer was, and they knew about chemotherapy, they knew about radiation. So they knew that those things could be in the pipeline or not. Of course, there's tears and everything, which is normal, but I think being straightforward about it is the best way to go, in my opinion.
Yeah. And speaking of being straightforward, like, I want to talk about the testicular cancer support group, because even when you were going through it and then in survivorship, you've educated yourself on testicular cancer, and you were very helpful in there. So anybody who's listening to this, who's part of the support group, if you posted, you've probably seen David, because I mean, you have really taken this and learned a lot about it.
Yeah, I have. And it's my way of coping with many things. If there is something going wrong health-wise, I will try and educate myself as much as possible. Now, this also comes because I've worked in academia for many years. I'm scientifically trained, as I would put it, which means that I can rather safely sift through Dr. Google. I've learned how to research the most strange archaeological questions through Dr. Google. So I know how to separate the relevant bits from the irrelevant bits, which isn't easy. Like, if you're not trained to do it, then I don't recommend Dr. Google. But luckily, I've learned how to do it. So this is Lucy coming to say hello.
Hey, Lucy. So yeah, I mean, talking about like the amount that you've learned and you're kind of giving back in your ability to answer some of the questions that people are asking. And testicular cancer is a disease of survivors, as we know. So, I mean, the mental part, you said that helps you cope. Like, talk about survivorship and how your mental health has been through survivorship.
the first parts of survivorship was like when all the hustle and bustle from a cancer diagnosis was slowing down. My mood also started going down. And I'm sure I'm not the only one to get into depression after cancer diagnosis. But we are, like my family and me, we are used to me having mood issues. So we follow up on it quite strictly, and we know how to. We've learned how to. But I knew that I had to find people that have the same experiences as me and that know what I'm going through. Because it was quite clear that I could not talk to many of my friends in the same way as before. Many people just don't understand what it means to have heard those words. Mm-hmm. You have cancer. And one of the things that has helped me greatly is Man Up to Cancer. You've had Trevor earlier this year, the founder of Man Up to Cancer. And that support group for men facing cancer, survivors, patients, caregivers, has really helped me a lot. I'm now one of the admins of Man Up to Cancer, which is it works in both ways. You give to a group and you get back from a group. It's the same with the Testicular Cancer Awareness group on Facebook. You can post about your difficulties or your victories, and you'll get feedback on that, and you'll get support for that. The sad thing is that support in Belgium is sorely lacking for patients with cancer. There are support groups for women facing breast cancer. There are a few groups with a few men with prostate cancer, but there is no follow-up whatsoever for men facing testicular cancer. You're just one of those few cases. I mean, in my regional hospital, I've asked the doctors, they see about 2 cases of testicular cancer at most in a year.
Wow.
So it's one of the things that is frustrating for me, is that if I want to find support, I basically have to cross the Atlantic to find some people that know what we are talking about.
Yeah, I was going to ask, because both of those groups that you mentioned are U.S. based. I was going to ask if there was any kind of Belgian equivalent. But, I mean, have you even met any other testicular cancer survivors over there, having been out about it now?
I know one other testicular cancer survivor. But he had testicular cancer when he was 17 years old. And he got the full load with BP, chemo, and then RPL&D surgery. But he's the only other one that I know.
Yeah. So what's next for David? I know you said you're a admin in Men Up to Cancer. I mean, is it just to keep spreading awareness and support?
Absolutely. One of the things that's, what do you call it? You call it pet peeves or something, is emotional and psychological support. I think even in the US, This is, and even in Canada, um, it is in Belgium, and I'm pretty sure it's in the UK as well. I've got some contact with the UK testicular cancer group as well, and I just noticed that psychological support is sorely lacking everywhere. There's support for when you're going through chemo physically, but how many people have proper psychological support when they're going through cancer? One of the things I always say is when you pull a muscle, you go to physiotherapy, right?
Mm-hmm.
Seems normal. Nobody thinks twice about it. That's what you do. You pull a muscle, you go to physiotherapy, you work with a physiotherapist, you get better. Maybe you'll pull the muscle once again in your lifetime. That happens. You'll go back to physiotherapy. But what people don't do is when they have pulled their mind, pulled their soul, so to speak, when you stretch the limit of your psychological capacity, people don't know what to do. Well, the answer is pretty easy. When you pull a muscle, you go to a physiotherapist. Well, when you pull your mind, you should go to a psychotherapist. Mm-hmm. And there shouldn't be anything weird about that. There's still a taboo about seeing a psychotherapist or seeing a psychologist or seeing a psychiatrist. People still think, yeah, but that's for when you're mentally ill, or when you're seeing a psychiatrist, that means that you're insane. And that's simply not true. If you have a lung infection, which is bad enough, you go and see a lung specialist. Well, when you have a depression that is pretty bad, go and see a psychiatrist. It doesn't mean you'll have to be there for life. I mean, they know what they are doing. They're there to help your mental health. If maybe you won't need a psychiatrist, but you'll still need a psychologist. If there's one thing I could change, then that would be what I would change. If people get out of the urologist's office and he confirms and says the words, "I'm sorry, sir, you have cancer," or even if for any form of cancer, the first thing that should happen is that there's a psychologist just outside to come and catch you and say, "Sir, madam, anyhow, let's sit down. Let's take a minute to talk. Let's discuss what happens and what is going to happen." And that should be a psychologist, and that's something we are sorely forgetting. And it's a very bad thing, and it's something we could easily remediate, but for some reason we don't. We're afraid of mental health.
Yeah, that was a great analogy that you said about like when you pull a muscle, you go to the physical therapist. I've never heard it said like that. So that, I mean, great analogy. Thank you for that.
It makes sense, right?
It does make sense. One question that I thought of, jumping back to the bipolar and the mood thing, mm-hmm. Was your testosterone affected at all? And did that have any kind of impact on the pre-existing bipolar diagnosis?
Well, it's hard to say for sure what hormone health is influencing my my mood, my psychological state of mind, and which part is just because it's me and this is what happens, or which part is influenced by hormones. But I know that I have been making how do you call it, a ride at the carnival, you know?
Roller coaster.
Roller coaster, yeah. I noticed that my testosterone was dropping just below limits, so I got referred to endocrinology. And one of the main issues was that I had breast glands that were swelling and they were painful. But endocrinology did not want to supplement my testosterone, although it was just below the limit. But they were like, yeah, but it's still okay, and it's not healthy to take testosterone. And they put me on other medications, and things just got worse. And just this month, I will see the university endocrinology department because they have more experience. They also have an andrology sub department, and I'm going to see them and see if they can help me out, because definitely doctors like to say, well, yeah, but you've got another testicle and it can pick up the slack. And, people survive with one kidney, so why wouldn't you be able to survive with one testicle? Well, yeah, stuff happens. I'm not sure what it is doing to my mental health, but it's definitely affecting my health in general. So I guess it's safe to assume that it's also affecting my mental health as well, for sure. Yeah.
Interesting. All right. My memory card is going to run out in about a couple minutes. So is there any last words you want to share? Where can people find you online to ask questions?
Find me on Facebook. If you have a mental disorder, if you struggle with depression, anxiety, if you are bipolar or you're on the autism spectrum, or your son is on the autism spectrum and is facing testicular cancer, send me a private message through Facebook. Always there to listen. I'm trying to help people. I can't change the entire healthcare system, not in Belgium, not across the Atlantic, but I try to help people one by one.
Yeah, man. And hey, even though you said your country is small, I mean, you're making a big impact around the world. So thank you so much for everything that you do for everybody.
Oh, thanks for that.
And thank you for being on It Takes Balls.
It was my honor.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.